Okay, imagine this. You're rushed to the emergency room. You've got this crushing chest pain, you can't catch your breath. The EKG looks really bad, and your blood work shows high cardiac enzymes, which is the classic sign of heart muscle damage. Everything, I mean, everything is screaming heart attack. But then the doctors do an angiogram to find the blockage in your arteries, and there isn't one. They're totally clear. This isn't a heart attack. It's something way, way stranger.
So that brings us to this age-old question. We've all heard the saying, right? Well, it turns out the answer is so much more real and scientifically fascinating than you probably think. Today, we're diving into a condition that pulls this idea right out of poetry and slams it into the reality of modern medicine.
And here's the real puzzle for doctors. This condition, which is officially called Takotsubo syndrome, or TTS, it's basically a perfect mimic of a classic heart attack. I mean, look at this. The symptoms are identical. The EKG changes, same. Those cardiac enzymes, both elevated. The only difference, and this is the absolute kicker, is the cause. One is a plumbing problem, a blocked artery. The other is triggered by pure, intense stress. So what is it exactly? Well, Takotsubo syndrome is a temporary, and that word is key, a temporary weakening of your heart muscle. It's brought on not by a clot, but by this just overwhelming wave of stress, either physical or emotional, that literally stuns the heart into not working right.
You'll hear a couple of other names for it too. Stress cardiomyopathy is a pretty obvious one, and the other is apical ballooning syndrome. And trust me, we're going to see in a minute why that name is so spot on.
Right, so this is the million-dollar question in the ER. You've got a patient who looks for all the world like they're having a heart attack. How on earth do you tell the difference between a blocked pipe and a brain-heart reaction when every second counts? Well, they've got a really clever trick up their sleeve. It's a diagnostic tool called the Inter-Takotsubo Diagnostic Score. Basically, it's a scoring system that lets doctors figure out the probability that they're dealing with Takotsubo before they even get the patient to the cath lab for that definitive angiogram. And what's so fascinating is what they look for. The biggest clues aren't just about the heart. Just being female gets you 25 points right off the bat, since about 90% of patients are women. Having a clear emotional trigger, bam, another 24 points. It even takes into account a history of psychiatric or neurologic issues. It's a much more holistic view of the patient than just their immediate heart signs. And get this, it's incredibly accurate. If a patient scores 50 or higher, there's about a 95% chance it's Takotsubo. This thing is a game changer, letting doctors think on their feet and adjust their plan in a huge way. Okay, so we know how to spot it, but what is actually causing this crazy reaction? This is where we get into the really powerful and sometimes kind of scary connection between our brain and our heart. Now, you might think it's all about emotional stress, a broken heart, but the reality is way more complicated. Emotional stress is a big piece of the pie, for sure, but physical stress, like a serious infection or a major surgery, is actually even more common. And almost a third of the time, there's no obvious trigger at all. And here's where it gets really wild. It's not always about bad things. Intensely positive events, think winning the lottery, a huge surprise party, even your own wedding, can also set it off. They actually call this version happy heart syndrome. It just goes to show you that any overwhelming emotion, good or bad, can be enough to tip the scales.
So what's the science here? It all boils down to stress hormones. When your brain perceives this extreme stress, it unleashes an absolute tidal wave of hormones called catecholamines. You know them as adrenaline and its cousins. This massive surge is literally toxic to the heart muscle cells. It doesn't kill them, but it stuns them, paralyzing them so they just can't contract properly.
That word, stunned, is the whole key to what happens next, the recovery. And this is where the story of Takotsubo really takes a hopeful turn. Because unlike a heart attack, this damage isn't permanent.
And remember that other name, apical ballooning syndrome? Well, this is why. Takotsubo is the Japanese word for a specific kind of octopus trap, a pot with a narrow neck and a wide, round bottom. During an event, the bottom of the heart, the base, contracts like crazy, but the tip, the apex, is stunned and doesn't move, so it just balloons out, making the heart look exactly like one of those traps.
And this is the most hopeful part of the entire story. In a heart attack, muscle tissue dies because it's starved of oxygen. It's gone forever. But in Takotsubo, the muscle's just stunned. Once that flood of stress hormones recedes, the muscle cells wake back up.
The damage is completely, totally reversible. The recovery is often just remarkable. I mean, the event itself is terrifying, absolutely life-threatening. But within just a few days or weeks, the heart starts to bounce back. For most people, their heart is back to its normal shape and full pumping strength in just 1 to 4 weeks. It's incredible. But just because the heart muscle recovers doesn't mean the story's over. Nope. The focus has to shift to preventing it from ever happening again. And that brings us to a really crucial point, a tale of two very different kinds of medicine. It's the question every single patient asks, and better now. But what do we do so this never, ever happens again? We know Takotsubo can come back, so what's the best game plan? The answer has actually changed in recent years, and it goes against what a lot of us used to think. Okay, everyone, this is probably the single most important takeaway from our entire explainer. For years, the go-to meds were ACE inhibitors and beta blockers, both standard heart drugs. But now the evidence has drawn a massive, bright line between them for Takotsubo. The recommendation is crystal clear. ACE inhibitors are the foundation of long-term treatment. They are proven to improve survival and lower the risk of it coming back. Beta blockers, the recommendation is to stop them once the heart is back to normal. They offer zero long-term survival benefit, and they do not stop it from happening again.
So why? Why this huge split? Well, the data is pretty damning. We have solid studies showing that patients who stay on ACE inhibitors just do better. They have better 1-year survival rates. Beta blockers just don't move the needle. In fact, one study found that a third of patients who had a recurrence were actively taking their beta blockers when it happened. That tells you everything. The thinking is that the stress pathways involved in Takotsubo are way more complex than what a beta blocker alone can handle. And that risk of it happening again isn't zero. It's around 2% per year. Now, that might sound small, but for anyone who's been through this terrifying event, it's a huge deal. And that's exactly why using the right medication, the ACE inhibitors, to hammer that risk down is so, so important. All right, so after walking through this whole medical mystery, from the initial shock to the recovery and the long-term plan, what's the one big thing you need to remember? At the end of the day, Takotsubo syndrome is a truly serious, dramatic event. But it's also a story of incredible resilience. It shows us that if we can spot it correctly with the right tools and manage it correctly for the long haul, and that means using ACE inhibitors, the stunned heart has this amazing ability to completely heal itself. Ultimately, this whole condition is just a powerful and kind of humbling reminder of the constant conversation happening between our minds and our bodies. The profound link is undeniable. It proves that the heart doesn't just listen to the brain, it feels what the brain feels. And that's a lesson about our emotional and physical health being fundamentally and sometimes dangerously woven together.